Public health officials in St. Lucia continue to closely monitor the outbreak of the China coronavirus. Chief Medical Officer Dr. Sharon Belmar-George says although the risk level for the region is low, the island is stepping up its level of preparedness.
The Department of Health and Wellness, we are proceeding with the necessary vigilance and preparation to reduce the possible impact on our population. We have been updating our existing influenza preparedness plans, and some of the activities that we have been working on includes but not limited to the education and sensitization of our health workers, non-health stakeholders and the general public, the enhancement of our port health services, active surveillance at high-risk institutions, prompt recognition strategies, measures to ensure isolation of ill cases in designated hospital isolation wards, establishing diagnostic capacity, working with the Caribbean Public Health Agency, contact tracing and quarantine of suspect cases, and the promotion of general hygiene measures and infection control for border agency, healthcare professional, and the general public.
Dr. George asked members of the public to continue practicing the standard recommendations to prevent the spread of infection. St. Lucians are also advised to guard against contracting the flu,
such as regular hand washing, cough etiquette in terms of covering your mouth and nose with disposable tissues, avoiding close contact with persons showing symptoms of respiratory illness such as coughing and sneezing. And we ask persons to share your travel history if it's significant, or to seek medical attention if you have symptoms suggestive of respiratory illness during or after travel.
So what are the symptoms to look out for?
The signs of the infection include respiratory symptoms, fever, usually a cough which is dry or unproductive, shortness of breath and difficulty breathing. In severe cases, pneumonia may develop, and severe respiratory syndrome, which is what leads to death. This new strain has not been previously identified in humans, and we wait, as with other countries. We've been receiving information on this new virus as it's being investigated. There's limited information on the characterization of the behavior of the virus, the severity of infection, and also the levels of transmissibility. We've been working closely with our international and regional partners who have been providing guidance as we manage the situation.
Statista reports that according to the Johns Hopkins University, as of January 26, 2020 at 11 p.m. Eastern Standard Time, there were 2,794 confirmed cases of the coronavirus, of which 2,737 were in China, with a further 14 in the special administrative regions of Hong Kong and Macau. The countries and territories that have confirmed cases of the virus are Thailand with 8 confirmed cases, while 4 have been detected in Australia, Japan, Malaysia, Singapore and Taiwan. France and South Korea also have 3 each. Winston Springer Jr., HDS News Force.